Good afternoon, and thanks for joining, everyone. I think we're about ready to get started. Wait one more minute for some people to join. Okay, I think we are all set. Before we begin our presentation, I just want to note that the views expressed in written materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the US government. My name is Taryn Patterson. I work with the Crisis Systems Response Training and Technical Assistance Center, who's been entrusted by the Substance Abuse and Mental Health Services Administration to provide support to states, territories, tribal organizations, and community partners across the 988 Suicide and Crisis Lifeline and Crisis Continuum of Care. Next slide, please. Today's event is a training and educational opportunity related to the design and operations of crisis systems and is not intended to be a source for individual treatment recommendations or for resolution of concerns related to individual experiences or interactions with service providers. We want to take a moment to remind you of a few options for further support should you need it. Whether you're facing mental health struggles, emotional distress, alcohol or drug use concerns, or just need someone to talk to, crisis counselors are available for you through call, text, or chat by dialing 988. Additionally, our CSR-TTAC team is available for free training and technical assistance or feedback and can be requested through our email or phone line that you see here on the screen. Let's ensure that we're all comfortable with the technical aspects of this webinar. We do have ASL interpreters joining us today, and closed captioning is enabled. If you need tech support or have questions for the speakers, please reach out by utilizing the Q&A function and we'll address it for you. We'll be hosting the Q&A session and office hours immediately following the conclusion of today's webinar. So today's webinar is 988 Crisis Systems Response, Older Adults Behavioral Health Crisis Care. And here are our 4 learning objectives. So please take a second to review these objectives. Next slide, please. So today's agenda, we're going to spend just a couple more minutes with introductions and a quick reflection activity to get warmed up. And then we will go into the background and scope of the issue with our 2 guest speakers. They'll cover signs and symptoms of common disorders, barriers to care, and strategies to support. And then, like I said, we'll close up with a brief Q&A at the end. So please feel free to think of some questions and include those in the chat. Next slide, please. All right, we want to just do a quick warm-up activity. This can involve your cell phone or a web browser if you're on a computer. We want you to think of the first words that come to mind when you see the words old or elderly. So go to menti.com, menti.com on your phone or computer and enter the code that you see on the screen, which is 5273. 4237 to participate. We have a bunch of words coming in: wisdom, stigmatized, disability, frail, vulnerable, grief, lonely, grandma, experienced, wise. Okay, great. So we have some good, you can continue to put those in, but we have one more prompt question. It'll be the same order of operations. So if you want to go to the next slide, we have our next prompt. And now same activity, but think of a person you know over the age of 65, so someone in your life. And what are some words you would use to describe them? Outgoing, wise, fun, loving, vivacious, grandparents, tired, feisty, irreplaceable, funny, unheard, resource, knowledgeable. Great. These are great. Um, so the main idea in this exercise here, if you've noticed some differences, the first prompt, we tend to respond to discrete words or messaging related to aging, such as seeing the words old and elderly based on stereotypes. Whereas the second prompt, when we were asked to respond based on our own personal experiences, we tend to use more positive words. So the first prompt did have a few positive words, wisdom, wise, things like that, but they were mostly negative, based more on stereotypes, so frail, disabled, dependent, things like that. Whereas the second group of words you can see are predominantly positive, and then some realistic ones like tired. So that's kind of the idea here, is to take an approach with every population, more an experience-based approach rather than thinking about kind of just the objective words or messaging that you're receiving about that population. Okay, so we can close up this activity and move on to why we're all actually here. So now I'm pleased to introduce the team at SAMHSA supporting these efforts for some welcome remarks. So a thank you to Jill Mays, Division Director of Crisis Systems Transformation, and China Locklear, Public Health Advisor at SAMHSA, for leading the efforts. So I'm going to turn things over to China for some brief remarks next.
Sure. Thank you so much, Taryn, and good afternoon, everyone. We're really excited that you've joined us today and are looking forward to having your participation towards the end of the workshop. As Taryn mentioned, my name's China. I'm one of the public health advisors at SAMHSA's 988 and Behavioral Health Crisis Coordinating Office, and I lead our crisis services across the developmental lifespan workstream. So really excited that we're launching this workstream today as our first workshop. Here at SAMHSA, we're dedicated to our mission of leading in public health and service delivery efforts that promote mental health, prevent substance use misuse, provide treatments that really support and foster recovery. And as many of you may know, over the past 10 years or so, the number of older adults over the age of 65 has significantly increased, and this population is projected to almost double by 2026. So keeping that in mind, along with increases in substance use disorders and serious mental illness, this is a critical population that we're committed to. SAMHSA offers a number of resources for older adults and those who serve them as well. And we look forward to today's workshop that's focused on reducing stigma and enhancing care. And then for more opportunities in the future to be able to connect with the TTAC and as well as the 988 office around this important topic. So again, thank you so much for your attendance and allowing me to give some brief remarks. And I'll go ahead and hand it back over to Taryn to introduce our two speakers. Thank you.
Thanks, China, and thanks, Jill. So I now have the honor of introducing our speakers for today's webinar. Amanda Krischer is the Associate Director of Behavioral Health at the National Council on Aging. She has over 15 years of direct practice and programming management working with older adults. And Kathleen Cameron is Senior Director at the National Council on Aging, where she serves as a subject matter expert on a variety of health-related topics, including mental health and aging. Her work supports policy and advocacy efforts at NCOA to promote systems change and improve healthcare and social service delivery for older adults. Ms. Cameron is currently the chair of the National Coalition on Mental Health and Aging. So now I'm going to turn things over to Amanda and Kathleen.
Excellent. Well, thank you so much for the introductions, Taryn. And I wanted to also welcome all of you to this webinar and to thank you for being here. and for your interest in this really important topic, because we know that behavioral health conditions among older adults are increasing. We see it not only in the data, but you're probably seeing it in your interactions with your communities that you work with, where more and more older adults might be using the 988 line and or seeking services for their mental health conditions from those who you work with. So we can go to the next slide. And we're just really pleased to be here to share about the work that we do at the National Council on Aging to help you think kind of broadly about the issues related to mental health and aging, and then provide you with information on potential partnerships, programs, strategies that you can use in your own work that you do every day. So I thought it would be important to provide a little bit of background on the National Council on Aging. Many of you may not know who we are, but we've actually been around for about 75 years. We're the oldest national organization dedicated to improving the lives of older adults. And, we believe in a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. So that's something we all want, no matter what age we are. We believe that aging well is something that every person deserves, and that the ability to age well should not be based on luck or any factor outside of our control, such as gender, color, sexuality, income, or zip code. So you can see here our mission and our goal. And we measure what we do very specifically, and we are working towards our social impact goal of improving the lives of 40 million older adults by 2030. And we focus on specific population groups in the work that we do. And mental health is a significant part of what we do at the Center for Healthy Aging. And we can go to the next slide. In general, our work focuses in two areas: healthy aging, where all of our mental health activities pretty much take place. And then we also have a Center for Economic Well-Being. And we develop a whole range of resources, trusted, unbiased information that enable older adults and their caregivers to take small steps that can have a big impact on their lives. And a lot of the resources that we provide are through our website at ncoa.org, as well as resources that we provide to community-based organizations that are serving older adults in communities all across the country. And I'll share a little bit more about the network that we support later on in the presentation. In addition, we have developed a range of tools, personalized online support for individuals to find benefits. So these could be federal, state, local benefits, like helping them apply for SNAP for those who have food insecurity, low-income heating, energy assistance programs, helping older adults decrease the cost of medications. We help older adults choose a Medicare plan that best suits their needs. And we have lots of other tools, including a falls-free checkup to address falls, which is the #1 cause of injury among older adults, helping manage chronic conditions, which we'll talk about, and then help plan for a healthy and secure life. We also provide a lot of funding opportunities at NCOA. We issue requests for proposals. So definitely encourage you to look at our website, and you can sign up for our newsletters and learn about some of those funding opportunities that might be appropriate for the work that you do. We provide a lot of technical assistance and support to community-based organizations and professionals who work in those organizations so that they can better serve older adults every day. And then we have a very strong advocacy team that works with policymakers in Washington, D.C. We're based right outside of D.C. in Arlington, Virginia. And we have a national platform and voice to fight against ageism, which we're going to be talking about today. And we also work to strengthen federal programs that we all depend upon as we age. So programs like Medicare, of course, Medicaid, the Older Americans Act, as well as all the programs that are funded by SAMHSA. So we do a lot of advocacy to continue the great work that SAMHSA does, and that takes funding. We also house the National Institute of Senior Centers. That's the only sort of membership area that we have at NCOA, and there are about 10,000 senior centers across the country that we work to support, and many of them are really modernizing what they do, and we've seen definitely a growth of work related to mental health in senior centers, where many more are employing social workers, for example, who are doing screening. They might be offering counseling within the senior centers and private locations, of course, and also implementing programs that address such things as depression, anxiety, substance use disorders, and other mental health or behavioral health conditions. So that kind of gives you sort of a general overview of the National Council on Aging. And now I'm going to turn it over to my colleague, Amanda Krischer.
Thank you so much, Kathy. We can go to our next slide, and we've touched on this a little bit, but wanted to just set the stage for us with some statistics and information. We know that our baby boomer population is continuing to age, and that population will reach, all that population will reach the age of 65 by 2030. So we are fast approaching having that whole generation now be considered older adults. And you can see kind of the increase in population over time based on these charts. We know that by 2040, it's expected that we'll have almost 80 million adults over the age of 65. So this is a population that we know is going to continue to need our support. And in order to best support them, we need to be able to understand what some of those conditions or concerns are that they are facing. So today we're going to focus more specifically around mental and behavioral health. So if we go to the next slide, just wanted to point out that approximately 20% of older adults experience a mental health concern in any given year. So it's a pretty significant number of older adults who are experiencing mental health concerns. We know that mental health concerns are not a normal part of aging. And so we want to be able to have the tools and resources to support them through the process to continue to live a long, healthy life and have good quality of life. The most prevalent condition among older adults is actually anxiety. Typically, we see either specific phobias as that anxiety or a generalized anxiety disorder. We also know that approximately 63% of older adults who are living with a mental health problem are not receiving the services they need. And we're going to talk about some of the barriers as to why that might be in just a few moments. We'll go to the next slide and talk a little bit about suicide and aging. We know that white males over the age of 75 have the highest rate of suicide in the United States. There's some research to tell us what some of the major risk factors are, which include major depression, physical illness, or functional decline. The good news is that there's also some protective factors that we can incorporate in the work that we're doing. So when our older adults feel that they have control over the situation, they have an increase in self-efficacy and self-esteem, they feel like they have good well-being and quality of life, they're satisfied with their life, have happiness and purpose. When we are able to engage them in coping techniques and self-forgiveness, as well as generating hope. And sometimes people will also find turning to religion to be a protective factor. And a lot of the programs that we'll talk about later are going to dive into some of these protective factors and help the older adult gain more around these protective factors, hopefully reducing their potential risk for suicide. We'll go to the next slide and talk a little bit about some of those common mental health concerns. So I mentioned that anxiety is the most prevalent mental disorder that our older adults are experiencing. And just to kind of make sure everyone's on the same page, to review some of the symptoms related to anxiety, that could be a person feeling anxious, nervous, afraid. They might not be able to control that worry. We sometimes can see restlessness and irritability and difficulty concentrating. Depression is one of the most underdiagnosed and undertreated conditions in older adults. And we know that this is not a normal part of aging. Oftentimes, the symptoms of depression in older adults can be missed because they might mimic symptoms of memory loss or illness. Some of the common symptoms that we see in particular with older adults are changes in their eating and sleeping patterns and an increased level of sadness. What's interesting is that the Mental Health America did a survey recently to learn a little bit more about the perception of clinical depression, and 68% of adults over the age of 65 said that they knew little to almost nothing about depression. So this is an area where older adults might not even realize that their symptoms are related to a mental health concern. 38% of those over 65 believed that depression was a health problem. And so we're seeing kind of that disconnect of recognizing when we need to seek treatment to ensure that we are meeting the needs of that older adult as a whole person, not just their physical conditions, but also their mental and emotional conditions as well. If a person was suffering from depression, older adults said they are more likely than any other group to, quote, handle it themselves. So this is a generation that is not typically seeking out help and support. If we think about their experiences growing up around mental and behavioral health, we can probably gather why. Only about 42% of people will seek help from a professional. And then finally, just a little bit about drug use or substance use disorders. Nearly 1 million adults over the age of 65 are living with a substance use disorder. Alcohol is the most commonly used drug among older adults. In the study at Mental Health America, they found that 65% of older adults reported high-risk drinking behaviors, and 1 out of 10 reported binge drinking, which is defined as 5 or more drinks per occasion for men and 4 or more drinks per occasion for women. So just some background to kind of help us understand a little bit more about some of these conditions. We'll go to our next slide and talk about 2 other conditions that can be commonly found in our older adult population. So we have our dementia, which is sort of the umbrella term for multiple types of diseases or symptoms. And this is a long-term brain disease that typically involves loss of memory, there could be loss of language or problem solving, depending on what area of the brain is being impacted. And these symptoms are consistent and progressive, so they will progress over time. And I just added a couple examples. Most people are probably most familiar with Alzheimer's dementia. There's vascular dementia, Lewy bodies, and frontal temporal lobe dementia. Delirium is a condition that can sometimes look like dementia. The difference is that a person who is experiencing delirium is experiencing a medical emergency. This often is resulting from some type of underlying medical condition. In older adults, most frequently, that's a urinary tract infection. These symptoms typically come on very abruptly and kind of come and go. So we might see a person who it seems to be relatively oriented and then sort of not so oriented and is experiencing more confusion. They might become more drowsy or seem quote unquote out of it, not able to pay attention, listen, or absorb information. So these 2 conditions also can impact older adults, and sometimes people will ask, well, how do you know which one is what the person is experiencing? If a person is having a rapid change in their symptoms, likely we're going to want to look at those underlying medical conditions first. So I always tell people, when in doubt, get that medical kind of evaluation out of the way first, have them check and make sure that it's not some underlying medical condition. And once that process has been completed, then we can take a look at what some of the other underlying reasons for those symptoms might be. On our next slide, we're going to talk about some treatment options. And there's a wide range of treatment options that are available for a person who's living with a mental health concern. And most people will benefit from a combination of these. We're probably most familiar with therapy and counseling and medication. There are also hospital programs that can help support a person who may be experiencing an immediate crisis situation. We have support groups and community programs, and then rehabilitation programs. So these are more intensive outpatient programs where a person is getting more consistent support for a period of time before potentially stepping down to a lower level of care like weekly counseling. So that gives us a little bit of background on some of the statistics and conditions that we're talking about. And now we're going to switch gears and talk a little bit about the barriers. Why is it that we have such a difficult time connecting older adults to behavioral health supports? So we're going to identify a couple of those barriers and sort of talk through them. So the first one, when we go to our first slide here, we're going to talk about ageism. We kind of referenced this a little bit in that warm-up exercise where we saw words that were typically seen as kind of these negative thoughts or feelings about older adults. And so I'm curious, we have just a few minutes here and our chat is open. I'm curious if anyone has any really good examples of ageism that you've seen in your work, in your community. Sometimes a definition is helpful. We'll put that up on the slide if we go to the next click. But what are some examples maybe that you all have seen in your experience? And you can add those into the chat. Give everybody a minute to think about that. Yes. Okay. So I'm going to read these out so you don't have to be scrolling through the chat. So treating an older adult like a child, absolutely. The way we change our words and speech patterns when talking to an older adult, we call that elder speak. Kind of sounds like we're talking to a dog or a puppy that sings songy, high pitched. Does not go over very well for most people. Assuming that they don't have agency, speaking over them versus listening, that they can't drive, that they don't have common sense. Oh yeah, we have good examples coming in here. Languages like calling them honey and sweetie. Absolutely. Giving them assistance when we don't know if they actually need help with that particular problem with the best of intentions, but we sometimes get caught up in that. Excellent. People, kind of being misdiagnosed because of health versus mental health conditions, that they're not tech savvy, can't use modern technology, they can't take care of themselves, that they all have dementia. Yeah, talking to other people in the room, not really engaging with that person, but going to a caregiver or a child. Absolutely. Yeah, just how they're treated in the healthcare space. Are they ignored when they come in with complaints of something? I read an article probably about a year ago at this point, and there was a woman who said she had gone to her doctor. She was complaining of right knee pain. She was in her 80s, I think. And the doctor was like, well, you're old, so of course your knee is going to hurt. And she said, well, my left knee is also 80 years old, and that one doesn't hurt. So something's not right. So the way that we're treated, not being able to take care of themselves, speaking loudly. Yep, we assume that they can't hear anything. Okay, that they can be frustrating. Oh, wonderful examples. Thank you so much for adding all of these. I'm not going to read through all of them just for the sake of time, but really great examples of what ageism looks like. Now, the good thing is that we can do something about it. If you're not familiar with the National Center to Reframe Aging, great resource that is really working and focusing on how do we change the narrative around aging. We are all aging, every single one of us, from the minute that we're born. And so we need to think about ways that we can turn this sort of depressed looking older person and the stereotype that older adults are sad and lonely into our next click, which will show us that older adults actually can be very vivacious, was one of the words that I heard in the initial opening conversation, that they have good quality of life. So focusing on reframing aging and reducing that ageism. We'll go to our next slide and talk about stigmas. There's a lot of stigma around mental and behavioral health in society in general. And then we also have the added challenge of working with a population that experiences around mental health during their formative years was extremely negative. So this particular generation often comes from the perspective of pull yourself up by your bootstraps, um, being referred to as crazy or insane. The experiences around mental health care as they were aging, growing up, were very scary. You think about electroconvulsive therapies and lobotomies and people kind of being swept under the rug into institutions that were very scary and in some cases worse than being in prison. So we sometimes have to approach the conversation a little bit differently. We might not be able to directly address what we know is a mental health concern, but we can kind of come at it from the sort of the side door and talk about their changes in sleeping and their changes in eating. And those might be ways that we can sort of open the door a little bit and start to reduce the impact of those stigmas. On our next slide, we'll talk about another challenge or barrier is that sometimes there's just a lack of knowledge or access. So I shared with you some statistics around a survey from the Mental Health America that many older adults aren't even sure what depression looks like or feels like. So we can educate people and get them to better understand what are those signs and symptoms. How is that going to look different for a person in their 60s, 70s, 80s versus maybe a person in their 20s or 30s? We also know that service availability is a huge challenge. We know that there is not enough mental health professionals to be able to manage all the people who need that care and support. And then when you're in a rural area, that can be even more challenging. The good thing is telehealth has become much more broadly available, which has reduced some of this challenge. And I think there's still work to be done here. But that is something that there's a big push to make sure that we have enough people to support this population. We also know that there can be racial disparities. Certain races and cultures may be even less comfortable seeking out support or having access to it. And for our practitioners, those who are serving these populations, sometimes they don't feel like they have the appropriate training to work comfortably with older adults. So the good thing with challenges and barriers is that there are often things that we can overcome and solve those problems. So our last and final barrier and challenge that we're going to talk about on the next slide are chronic health conditions. We know that about 95% of older adults have at least one chronic health condition, and almost 80% are living with two or more. 1 in 4 older adults experiences a behavioral health problem such as depression, anxiety, or substance use. And these rates are even higher for those who are living with a chronic health condition. So if they have that chronic health condition, the rates of mental health concerns can be even higher. And we know that mental health problems can complicate the physical health conditions and their treatment, and sometimes vice versa. So we really need to be mindful to take care of the person as a whole and really use those integrated care models where we're not only addressing those physical health conditions, but also addressing and managing the mental and behavioral health conditions as well. So I had the fun of sharing all the interesting statistics and research and background for you. And now I'm going to turn it back over to Kathy, who's going to talk about some strategies to support mental wellness and some training opportunities and education programs.
Great. Thank you, Amanda, and thanks everyone for the great, really important comments. It was clear from what you all put in the chat as you have recognized ageism in the work that you do, and that is such an important first step in working with older adults. So thank you for that. So yes, I'm going to talk about strategies to support mental wellness and talk about the network that the National Council on Aging that we engage with and support and collaborate with all across the country. And I'm hoping that you can think of, if you're not part of this aging network, think of them as real partners and collaborators in the work that you do in your own communities. As you think about improving the local response systems all across the country. So this is a diagram of what sort of the aging network looks like. And it kind of starts at the Department of Health and Human Services. There is a small agency, and I say small because it's much smaller than some of the others, like SAMHSA and CMS, for example. And it's called the U.S. Administration for Community Living, and really works to support older adults as well as people of all ages with a range of disabilities. And the U.S. Administration for Community Living administers the Older Americans Act, which is funding that flows from the federal level to the state to the local level to support programs and services that are delivered to older adults, primarily in their own homes. So the money flows to the 56 states and territories, to the state units on aging, some of which are called state units on aging and disability. And every state has sort of a different name for that agency. Many of those state units on aging do partner with like the Behavioral Health Authority or the Substance Use Authority in the states and other agencies. And we've been trying to make that happen more and more because we need a coordinated system of care across a variety of different state agencies to improve systems of care for older adults. From the states, there are over 600 what are known as area agencies on aging. And those are kind of hubs within communities where older adults, caregivers, and family members can go to find support. Many of them run what are known as the Aging and Disability Resource Centers, which can do screening and assessment and identify the needs that older adults and persons with disabilities have and connect them to local services. And across the country, there are 20,000 local community organizations, senior centers, and other service providers that provide a whole range of services that address the social determinants of health primarily, or the health-related social needs. So places, like I mentioned, senior centers that provide programming around many, many different areas. They also connect older adults to services. They provide often a warm meal every day to seniors who go to senior centers. There are transportation providers in communities. There are nutrition service providers, such as those Meals on Wheels providers that deliver meals to the homes of older adults who can't get out. There are a whole other range of community-based services. Family caregiver education and support are provided through these local community organizations. Also, as part of the network are the Adult Protective Services Network, legal assistance, in-home personal care services, and benefits enrollment centers or the state health insurance assistance programs that help older adults access the services they need to live their lives. And then there's a range of health promotion, disease prevention programs that are delivered by this network. So as you can tell, it's pretty vast, but the important message here is that this whole network can serve as really great partners for all of you in the work that you do. And there's something known as the Elder Care Locator, which is both a website and a 1-800 number that older adults can go to or their caregivers can go to find out where their local area agency on aging is to get connected to that area agency on aging. And those at the local level, they have different names as well. Some are called the Area Agency on Aging, but some might be Senior Services or many other names. But the Elder Care Locator is a great tool for you and older and many others to know about. Okay, we can go to the next slide. All right, so I wanted to just share with you, first of all, some important training resources. We go to the next slide. And I think this is sort of a go-to resource, honestly. It's known as the E4 Center, and it stands for the Center for Excellence for Behavioral Health, Disparities, and Aging. And it is a center funded by SAMHSA. And it is a place where you can go to for training. They have a range of lots of free training that you can take to better understand the needs of older adults related to behavioral health, treatments, services. You can really get up to speed. But I think for this particular audience, for all of you, they have created modules specifically for 988 and other crisis call centers. And the modules focus on ageism, cognition, common life issues, depression, anxiety, substance use, and suicide. And really what's great about these modules is they're 15 minutes in length, but they get to the point very quickly and provide implementable information for those who use the modules to learn. So they provide kind of practical strategies for communicating with older adults in crisis. I think that's one of the most important things that these modules do. They list unique risk factors for older adult suicide, substance use, anxiety, and depression, some of which Amanda talked about today. They identify common life issues that impact older adult functioning and really recognize ways that ageism impacts all of us. So definitely would recommend these modules as a way to kind of augment your understanding of the needs of older adults. And I believe that the E4 Center might be speaking maybe at the next webinar as part of this series. So we can go to the next slide. So wanted to share with you a bit about some training programs that are available for everyone in addition to the E4 Center. And the first one that maybe you've heard about is the Mental Health First Aid Program. And that's an evidence-based early intervention course that teaches participants about mental health and substance use challenge. And there is a specific program for older adults. So there's a training that has been designed, adapted specifically for the unique needs of the older adult population. And you can find that at the National Council for Mental Well-Being. And we can put that address in the chat. So definitely recommend that. And then some of you might also be familiar with the QPR, Suicide Prevention Training Program. And that's a way for practitioners to recognize the warning signs of suicide, and it uses an approach called question, persuade, and refer for people who need assistance. And there is online and in-person training available across the country, and that's available through the QPR Institute. And also want to let you know that does meet the National Registry of Evidence-Based Practices and Policies at SAMHSA. And then SBIRT, which stands for Screening, Brief Intervention, and Referral to Treatment. That is an evidence-based approach to identify people who might be at risk for substance use, misuse disorders, or who are currently experiencing substance use. And it uses motivational interviewing for as part of the intervention to help older adults and many others with substance use disorders. And there is training available all across the country through academic institutions. There are some, healthcare systems, healthcare providers mental health providers that also provide this training. So definitely encourage you to take a look at that. And there has been quite a bit of research showing the positive impact, really significant impact that SBIRT can have on reducing substance use. And that includes alcohol use and prescription drug misuse, which are the two most common types of drug misuse disorders among the older adult population. And you probably also are aware SAMHSA has a whole section on their website about SBIRT that's really super helpful and includes information about how you can bill for providing SBIRT. It has the specific codes listed. So we can go to the next slide. All right. Now I'm going to talk a little bit about some of the community-based programs that the network that I talked about earlier, the Aging Network, delivers, as well as kind of services that are growing in communities across the country. So we can go to the next slide. And the first is what is known as the Chronic Disease Self-Management Program. And this is one of several self-management programs that was developed several years ago by Stanford University. And you can kind of think of these programs as empowerment programs. They provide tools and resources, puts them into the hands of people who go through these programs that have traditionally been delivered in community settings like senior centers, for example, or parks and rec, YMCAs. I mean, really all over the country, they're being delivered, but help people manage their chronic illnesses. And that's particularly important, as Amanda talked about, because we see so much co-occurrence of chronic diseases with mental health. But this program has also been shown to reduce depression by 21% for people who have depression who go through this program. So it's offered over a 6-week period. It's a very interactive program that helps adults living with chronic illness manage and improve their health. And each class kind of goes through a different topic, ranging from things like pain management, nutrition, the importance of regular physical activity, improvement in medication use and adherence, how to deal with emotions when you have chronic illness, and then how to better communicate your needs and ask questions with your healthcare providers. So this program is delivered by trained facilitators, one of whom has to have a chronic illness. And often that person is a peer, someone who's gone through the program before and really understands the program from a very personal perspective and can help lead the discussions throughout the program. So where do you find out about where these programs are offered? Again, probably call your local area agency on aging, because they should know when and where this program is being offered. So again, it's called the Chronic Disease Self-Management Program. Sometimes it's called different things, though. That kind of complicates things. For example, in some states, they use better choices, better health, aging well with a chronic condition, and many other terms. But the primary one is this chronic disease self-management. Okay, we can go to the next slide. So you're probably familiar with some of these services providers listed here on this slide. And the first one, CCBHCs are known as Certified Community Behavioral Health Clinics that provide either directly or through formal partnerships with organizations in community, provide crisis services, outpatient mental health and substance use services, person and family-centered planning, treatment planning. They address the needs of veterans. They provide peer family support and counseling services, targeted care management, and many other services. And they, by law, when an organization receives CCBH funding, they have to serve the mental health needs of populations of all ages. So older adults are seeking services from CCBHCs. And many of them are taking trainings like this one to be more knowledgeable about the unique needs of older adults. But CCBHCs can be found in 46 states. There are about 500 of them across the country. And there's been a lot of new funding to support CCBHCs through planning grants, through CMS, Medicaid, and other sources. So it's important to understand that this is kind of a growing service provider because they also can serve as a partner and a referral for people who may need services who contact the 988 service lines. And SAMHSA is providing lots of support for the development of the CCBHCs. The ACT program is known as Assertive Community Treatment Program, and that helps older adults and others learn skills to help them achieve their goals, establish independence, and living meaningful lives through communities. So some of you may already be working with ACT programs that also can be found across the country. And then the Friendship Line is a really amazing service that serves all, it's only available right now in the San Francisco Bay Area. So for those of you from that area of California, it would be a great partner to work with. But it is based at the Institute on Aging's, and that's in San Francisco, the Institute on Aging. And it's a warm line that provides emotional support and a friendly conversation for older adults who have mental health conditions or might be feeling, anxiety, depression, and other common conditions among the senior population. So this is, to me, a program that I would love to see replicated across the country. But it's part of the Institute on Aging's Center for Elderly and Grief-Related Services. I just saw Oregon. Oh, that's great. Has something similar. Fantastic. So it's a little bit somewhat like a 988, but specifically for older adults, maybe not for those who are in crisis, but it's to prevent crisis from occurring. So, all right, we can go to the next slide. All right, and these three programs are what we consider evidence-based behavioral health programs that are being delivered currently by organizations within the Aging Network. And the first one that I'll talk about is known as Healthy Ideas. And IDEAS in this case stands for Identifying Depression, Empowering Activities for Seniors. And it integrates depression awareness and management into existing case management services. So if an area agency on aging, for example, is doing case management, the case managers can get trained to deliver this program, beginning with screening and assessment that's done as part of the case management process. And it consists of it's a program that lasts up to 6 months. And after the initial screening and assessment is done for depression, meetings take place in the client's home. It depends on the frequency depends on the condition of the recipient, but it's implemented by typically a social worker slash case manager. And this program has been shown to be highly effective in reducing symptoms of depression, and it really helps older adults in many different ways. It helps older adults kind of think about their goals, their objectives, how they can create their own plan of care in reducing some of their symptoms in conjunction, in some cases, with medical treatment for their depression. But a big part of the program is behavioral activation. That's one of the components of the program, and that's really what works in helping to reduce the severity of depression. So that's a program, I would say that's probably the most common evidence-based depression management program being offered across the country. And we can provide information where to get access to this program. It's run out of Area Agency on Aging in Massachusetts that provides all the training, the resources for implementation of the program. Okay, the next one is known as Pearl. We can go to the next slide. Oh, no, we can stay here. Sorry. Program to encourage active, rewarding lives, or PEARLs. And this is a little bit similar to Healthy Ideas, but it actually is kind of more of a collaboration with healthcare providers. The format for the PEARLs program is 6 to 8 one-on-one sessions in the client's home or other community setting. The program can also be delivered remotely if that's appropriate for the recipient of the care. And it really focuses on teaching the client, the older person, skills necessary to move kind of from action to make life changes that they need to help them better manage their depression. And it includes a team-based approach involving a counselor, a trained counselor in the PEARLS program, a clinical supervisor, and like I said, a healthcare provider. And it really has been shown to improve quality of life and reduce depressive symptoms among older adults. And it's been well studied for older adults with chronic conditions, specifically those who have a seizure disorder. So that's PEARLS. And then the next one is a really excellent program that you might have heard about because it's known as WRAP, or Wellness Recovery Action Program. And it's been used for, gosh, probably 20 to 30 years. And it was developed by and for individuals with mental illness. So I think that's what's really important about this program. And it's a peer support program. It's peer support led by a trained facilitator in the discussions for the WRAP sessions. And it is a prevention and wellness program or process that anyone can use really to get well. It's for people with depression, PTSD, anxiety, serious mental illness, and other conditions. And it's delivered in a group setting, and individuals who join the program kind of discover their own sort of simple, safe wellness tools. They create their own crisis plans, as well as they create a post-crisis plan. So, and over the last couple of years, it's been studied and used more with the older adult population. It's found to be effective, and now there are tools available to implement the program with an older adult population. And the resource, it's mentalhealthrecovery.com is where you can find more information about the Wellness Recovery Action Plan program. So those are 3 of several different types of behavioral health programs that are being delivered in the community right now to older adults that we wanted you to be aware of because they really can augment, the work that you might be doing within the mental health community. We can go to the next slide. So we really wanted to share with you a couple of other events that the National Council on Aging is hosting. We are going to be offering the 8th annual Older Adult Mental Health Awareness Day Symposium, and that's going to take place on May 1st of next year. So please save the date. That is a free virtual program. It's a full day program, but all the sessions are recorded if you aren't able to join them all. That will consist of a variety of different topics, many of which, we've touched on here, but they'll be provided in much more detail. Each session will have a description of kind of the scope of the issue, someone speaking about the issue from their own lived experience, and then each session will talk about solutions. What are sort of evidence-based solutions to address the issue? So definitely, and that is funded through the Administration for Community Living. We also get support from SAMHSA and from HRSA for that event. And then finally, NCOA hosts an annual conference. It's called Age Plus Action, and there are typically some sessions on behavioral health issues among older adults at that conference. And that'll be in May, late May, in Arlington, Virginia. So that'll do it for me. But I want to thank you so much for your attention, and I think we're going to spend some time answering questions.